Finding problems? That's easy. They exist in every community. I'm Terry Springs, your host. We're looking deeper, and we are talking solutions, finding out how we all can make a difference. We all know technology has changed our lives big time. Like a few years ago, none of us had a smartphone. They weren't even making tablets yet. And an app was something you ordered before dinner at a restaurant, right? And technology has made some really exciting changes to the way that we interact with our doctors. Dr. Eugene Somphone is here from Southwest Medical Associates to tell us about some of these great changes. Thanks for coming in.
Thanks for having me.
There's so much that's changing. I've noticed in appointments that I've been on, in the past few years, now they've all got iPads. You don't see quite as much paperwork. A lot of things being done electronically, which is great. When as a patient, when they want me to update my record, they have me do that online too, so that it's ready to go. There's something else that I've heard about, this Now Clinic. Can you tell us what that is?
Sure. Now Clinic is our brand name for telemedicine. Southwest Medical started its telemedicine practice about a year and a half ago. I can tell you that every major insurer in the country, every large employer, every large medical group has either a telemedicine program in the works or already established. We got a jump start because we started ours back in January of 2014, and to date we've seen almost 10,000 patients virtually. What Now Clinic is, it's a platform that allows patients to communicate through video chat with a provider. These are for non-life-threatening conditions that don't require an examination. You can connect with a provider either through your home computer, laptop, or mobile device. Usually you'll get a provider within 6 to 8 minutes. The conversations are pretty short, about 6 to 8 minutes, and the prescriptions are sent electronically to your nearest pharmacy. So it's a great satisfier for patients. It's very convenient, very timely.
Dr. Somphone, do all physicians participate in Now Clinic, or is it just certain doctors who are involved?
It's a fairly new field, but it's very fast growing. And with any new technology, there's an adoption rate. So it takes time for patients to become comfortable, and likewise for providers. I know only a minority of providers do this, but I can tell you in the next 5 to 10 years, it's poised for tremendous growth. We all recognize we can't continue medicine the way we have right now. It's just too costly. So we want to direct patients to the right area of care. In other words, if you don't need to go to the emergency room, go to urgent care. If you don't need urgent care, go to telemedicine. And I think that's one of the solutions we have long-term to our healthcare needs in this country.
We need the help because we are limited on the number of doctors that we have access to, and your time is so valuable. I'm thinking that using a platform, as you mentioned, like Now Clinic, through my smartphone, for instance, I can think of a couple of instances just within the past couple of years where that would have come in so handy. I got a bug bite, and everybody was like, "Ooh, you should have a doctor take a look at that." With Now Clinic, I could take my smartphone and say, "Check this out. Do I need to come in and see somebody about this?"
Exactly, and the video is HD quality, so you can actually identify rashes and all that kind of thing. You mentioned my time is important, but your time as well. We recognize that patients, to go to urgent care, you're taking a half day out of work, you're driving, you're bringing your kids in sometimes, you're having to wait. Your time is important. I think medicine, we're moving from a physician-centric type of practice to more patient-centric, patient convenience. Imagine just having to drive through rush hour, or let's say you're in a rural area, having to drive 2 hours to see a provider. This really brings patients much, much closer to providers. Now, it's not for everyone. We still have a large segment of patients who really want to be able to see their own physicians, be touched. We recognize that. But for a large segment of patients, we can take away the inconvenience and get you directly to a provider with similar outcomes. We measure outcomes in terms of safety and outcomes, whatnot. And I can tell you that in this world here, the outcomes are certainly not inferior, but perhaps even better, because we rate these with patient satisfaction scores, and scores much, much higher than your traditional ER visit or urgent care visit.
Sounds like a terrific idea, because to actually go see my doctor when something's up, even if it's not a major problem, I need to see him at the last minute. I've got to make the appointment. We've got to find a time that works for both of us. I've got to get in there. I've got to do the paperwork. I need to see a nurse so that they can do my weight and my blood pressure, and then I'm sitting waiting in another room, and then eventually I get a few minutes with my doctor to figure out what's going on. If not my doctor, maybe a physician's assistant. But somebody will see and diagnose at that time the problem that I'm bringing forth. But with Now Clinic, if I could actually just do this with a little bit of one-to-one video chat with a doctor, that sounds like a great answer. I can't imagine how many more patients throughout the course of the day you as a doctor might be able to see with the help of video conference.
You're exactly right, because these are very quick visits. The last thing you want to do is, as a patient, have to take the time out to drive to urgent care. And let's say it's middle of cold and flu season where you may have to wait a considerable amount of time. It's a higher copay, dragging your kids in. With Now Clinic, the average response is about 6 minutes, sometimes even less. So it's very quick. You can do it from the comfort of your own home. I've had patients do it from their bedrooms. It's a very quick visit. You can make a diagnosis, and your scripts are sent electronically to your pharmacy. Just much, much more convenient for everyone.
Dr. Somphone is with us today on Talking Solutions. We're discussing some really exciting changes on the medical front as far as technology and your doctor's visits. Maybe the next time you need to see your physician, you don't have to go in person. And it seems like we can order anything online these days. I order so much stuff on my smartphone. There's a lot of stuff that you can do using your smartphone. And maybe your next medical appointment, you can save yourself a lot of time and trouble. Dr. Somphone, you mentioned a moment ago about going to quick care. When you're in that waiting room and you're not sure how long it's going to be, what about all the other sick people that you're spending time with?
Exactly. Not only are you waiting a long time, but now you're stuck in a room full of people who are coughing and sneezing and touching, and you're there for a rash or a medication refill. So yes, in addition to the inconvenience, you're subject to a lot of germs. At Southwest, one of the things that we've introduced to alleviate the crowded waiting room, you can check in online. You see these billboards around town. For a lot of conditions, you can check in virtually. You have a place secured so you don't have to wait quite as long. That's just another thing we can do to hopefully make the patient experience much more enjoyable. Now Clinic is another avenue you can pursue to alleviate some of that waiting, the co-pays. It's all about patient convenience.
There's a lot of stuff that you do see as we're driving along the road. Maybe on the 215, you see a billboard and it'll tell you what the expected wait time is in an ER right now. And there's ways that you can find out about how long you might be waiting or any number of things. It's just we have such great access to information through technology. How long have you been in Las Vegas, Dr. Somphone?
We moved here in 1976, right before my third grade. So I'm pretty much a Nevada native. Went to school here locally, graduated from Clark High School, went to school of medicine here in Nevada. I've been at Southwest Medical now for 17 plus years. So I don't like change. So I've been at Southwest Medical for quite some time and probably retire from there.
You must like change in some ways because you've really adopted the idea of Now Clinic as a great new way to interact with more of your patients.
Southwest Medical has always been very innovative. So even though I've been there for a long time, we don't want to be stagnant. We've had electronic medical records for close to 15 years now. We've prescribed electronically for almost 10 years. We've had digital radiology for at least 15 years. For us, this is just another step in the right direction. We don't want to get caught behind the times. So we've been always very innovative, and we've always pushed the envelope, whether it's with our urgent cares. We see 250,000 patients a year for our urgent cares. This is just another channel that we have to provide better care for patients and to reduce some of the inconveniences.
Medical costs always seem to keep going up, but it sounds like by using technology for things like Now Clinic, we're actually reducing some of those costs. Does that make sense?
You're absolutely right, because we obviously cannot continue this trajectory. Nevada, as you know, probably ranks close to dead last in terms of number of providers per capita. So we're already stressed for access. Last year with the Affordable Care Act, we added more than 250,000 patients to the ranks of the insured. So it's a system that's already stressed. Now you add another 250,000 patients. And this is another way that we have to improve patient access to providers. I think as a new patient to the system, to get and see a new primary care provider, it's going to take you 4 to 6 weeks at least. This is a way that we can access providers quickly and timely in a very efficient and cost-effective manner.
So many people were able to get insurance coverage. As a doctor, how does that affect you? I'm sure you're happy that all these people have access to medical care, but then you go, where are we going to put them?
Exactly. My role is medical director for Southwest Medical's on-demand care, which encompasses our urgent care and telemedicine. Last year with the Affordable Care Act, we added so many new patients to the ranks of the insured. United Health, which is our parent company, is the state's biggest player in that arena. So, in other words, we are the biggest provider for these new Medicaid patients. They have nowhere to go. Where do they go? Urgent care. We're hoping to add this to our Now Clinic as well. Previously, Medicaid patients could not access telemedicine here in Nevada, but recently through the legislature, we've enacted some new rules that they can. So this is just another avenue they can pursue to gain care to a provider. Now, many of these patients for many years had no provider care whatsoever. They're coming into a system not having seen a provider for 5 years or more. So they have a lot of needs.
I would imagine so, because when you, for whatever reason, because of necessity, or a lot of people just don't want to go to the doctor unless they have to, but when you're not keeping up on things as far as your health is concerned, problems do accumulate and you have a lot of issues when you get there. And you've got to get diagnosed, and we've got to have the labs and the tests to find out where you stand so you can find out exactly how you need to treat this person.
You bring a great point, because many of these providers have not had access to care for many, many years. The way that providers are now graded has to do with, are you checking those things that are recommended? Are you screening for lipids and diabetes, mammography? Many of these patients have never had these things for many, many years. We recognize that many of these patients, their only time of care is when they come to urgent care or hopefully telemedicine. So we use that opportunity now to screen those things. We'll say, Mrs. Smith, you haven't had a mammogram in 10 years. Here's a slip to get that done. You haven't had a pap smear. We'll direct you to the right place. You haven't had a lipid checked in more than 10 years. So we're trying to bridge those gaps in care as much as we can, because we recognize otherwise these patients will never get these things done.
And that leads to some pretty dire situations. When you've ignored it for a very long time, you can have some stuff that you're facing that's pretty serious.
Exactly. It's all about prevention, because once you acquire a disease, then certainly the prognosis is much worse, much more costly. So what we're trying to do is we're trying to screen patients for what is recommended, hopefully prevent them from developing colon cancer, those kind of things, or at least catching it early on.
Preventative is a huge word, because across the board, as Americans, these medical costs are very, very big on the society as a whole. If we could do more preventative work and not have to deal deal with the extreme, excessive cost of dealing with that cancer or some kind of a tremendously severe medical condition, it would make such a difference for everyone.
You're absolutely right. And it really has to do with how we approach medical care. I think too often in a fee-for-service environment, which is the vast majority of the United States, we tend to do too much. We order the wrong tests. At Southwest Medical, in our department in particular, we are very guideline-based. If the recommendations say, do this, we will. And you want to be able to capture those things early on before it becomes a major disease and it's too late. And all of a sudden, the costs are skyrocketing. That's really our main focus as a health maintenance organization. We're trying to practice by the guidelines and do what's right for the patients with better outcomes.
Education is so important. I like the idea of the Now Clinic. By the way, today on Talking Solutions, we are talking with Dr. Somphone. I love the idea of doing more preventative medicine because it does save some huge costs. It seems like a lot of this goes back to us all having access to the internet. Now that it's becoming very user-friendly where our medical care is concerned, Southwest Medical Associates has always had a really great website. You've got a lot of information on there.
Yes. The analogy I give is online commerce. Think about it. Just a decade ago, who would have thought online dating, buying a car over the internet, buying shoes and clothing, right? But now it's second nature. We've taken technology to a new level in terms of medicine too. We have a very active web portal. We get about 1 million hits every single year. And it's not just by the younger generation. We see a lot of seniors too. They can access their own medical records, lab results, make appointments, check in online to urgent care. There's a number of things that you can do. And it's really transforming how we practice medicine, both from the consumer and the patients and from providers as well. Patients can actually now access their providers through what we call e-visits. So you have a simple question, you can send them an email and get a response back within a day or so. These are things that are just tremendously convenient for patients.
You never feel like you can talk to your doctor. I understand they're busy. I'm okay with that. But it seems like if I've got a question and I really would like to have my doctor give me an answer or advise me on it, first I need to go to the front desk and then they need to see if we can get the nurse. And if she's available, that's great. And if not, I need to leave her a voicemail. Then she gets back to me at some point in time. Hopefully, I'm answering my phone or looking at my email at that point in time. Every step is difficult. Nobody means it to be that way. It's very time-consuming. Then down the road, maybe if everything works right, then I might actually get advisement from my doctor. It would have been a very simple question if I could go more direct.
It's just as hard for me to get access to a provider. When I need to call someone for their advice or just let them know I saw the patient, it's just as hard. This really reduces those barriers, because now patients can directly email and contact a provider. And yes, they are busy, but every day they will check those messages and get back to you. So it really brings patients and providers much, much closer. You know, as a group, our patients are very tech savvy. You'd be amazed. We do over 5,000 e-visits every single month. So once this gains some momentum, patients love the service. They send email, and usually within a few hours, they get a message right back from the provider.
It's just a matter of us getting the word out, which is why we've got you in with us today on Talking Solutions. Technology is our friend when it comes to medical appointments and access to our doctors. Southwest Medical Associates, this is working out great, and people are really adapting to it as well.
Yes, there is an adoption rate, but I can tell you in year one, we saw 5,000 virtual visits. That's probably more than just about any other practice in the country. Year two, we're on pace to see 10,000. Next year, maybe 20,000. So we're seeing this exponential growth in terms of adoption for telemedicine. I really see that in 5 years, a lot of patients, instead of thinking, okay, urgent care first, they're going to be thinking Now Clinic.
I think it's going to benefit everybody across the board because we talk about the numbers swelling so greatly as far as the people who now have access to medical care. Traditionally, especially here in Las Vegas, I know you and I have both been here for a lot of years. It started in the emergency rooms and they were just overwhelmed. The waits were long, and I'm sure that the people who work there trying to do their best were terribly stressed. I know I would have been if I knew that the line of people was never going to end. And not just emergency rooms, but as you mentioned, quick care. That seemed to be the only options that we had at that point. And a lot of times when you need that assistance, it's on the weekend when your doctor normally is not practicing. Those are not office hours. So on the weekend when I need some help, now I have another option.
Yes, you're right. There are conditions that cannot wait. You can't wait till the next morning. There are life-threatening conditions. We recognize that. We also recognize that more than half of all ER visits are for non-life-threatening conditions. And that's really why urgent care sprung up, because we recognize a lot of patients don't have life-threatening emergencies, but they can't wait. Now, urgent care visits, we also recognize that half of those patients probably don't need to go to urgent care. There's another avenue of care, which is telemedicine. I know there's some concern about safety. You know, can you really make a diagnosis without an examination? We've looked at that very closely. We've looked at outcomes, and I can tell you that year to date, we haven't had a single quality issue that's raised. And the other thing is that we have higher patient satisfaction. So I would argue that not only are the outcomes better in terms of overall care, because we have the same outcomes, but much higher patient satisfaction. Patients patients certainly are voting with their feet because we're seeing tremendous growth in this area. And it's really more cost-effective care. Now these patients don't need to go to ERs, they don't need to go to urgent cares, they can go directly to telemedicine.
How can you not love the idea of being able to get the medical advice that you need without having to make the appointment, get in the car, wait in the waiting room, go through the whole routine that has been medical care for decades?
Sure. We recognize this is not for everyone because you will have patients who really do want to see their provider. They want to be examined. But I can tell you that based on our exit surveys, this is a huge satisfier. 95% of patients rate us a 4 or 5 stars out of 5. They're clearly very happy with the service. So for a certain segment of the population, this is the right avenue of care.
Not much of a downside here. You're telling me that there had been questions whether or not this would be effective. Would there be maybe difficulty in giving a diagnosis? We're taking advantage of a Now Clinic or an e-visit. But as you mentioned, the patient satisfaction is very high. Once they try these technology-based approaches to medicine, people are like, this is great.
Once you try it, you have a good outcome, you're sold. And you're thinking, why did I ever do it that way? But that goes for a lot of different things. I'll give you a classic example. I saw a patient, it was about 5 in the morning, and she had a simple bladder infection. Very simple. You can recognize the symptoms: burning, frequency, urgency, very clear-cut diagnosis. At the end of it, she was incredibly happy. She said, you know what, my husband's out of town on business. I've got 2 young kids. I could do this right from my bedroom. And her script was sent electronically. She picked it up as soon as the pharmacy opened. So she's very happy. So next time around, I'm sure she'll use this for her kids, for her husband, for herself.
I've been there with that infection thing, and on the weekend, you are not comfortable and you want to take care of it right now.
Yep. And we have 24/7, 365 access. It's available all year round.
Where should we start? If I'm a patient and I have Southwest Medical Associates and I say, I haven't tried these services, maybe I would like to look into a Now Clinic or an e-visit. Where do I go? Do I start at the website?
You can go to the web portal. You can go to the App Store and download Now Clinic. Very easy to do. You do have to get enrolled, and that takes just a few minutes. And after that, you're good to go. There's a few tests that they'll ask you to do, make sure your computer is compliant with Now Clinic. But after that, it's very, very simple. It's a very low copay as well. And after that, it's very, very simple.
I know that when I do things medically online, I've always got to deal with the passwords. And that also has to do with patient privacy rules. I'm sure that none of that changes when it comes to dealing with SMA online.
Yeah, this is HIPAA compliant. It is very safe and secure. But you're right, you do need those kind of things. I know it's kind of annoying to have to put your password in and whatnot, but it's meant for your privacy and your safety.
And I understand, and when they call and they leave me a voicemail, they can't really let out all the information once again because of patient privacy regulations and rules. I appreciate that, and that takes a little bit of time. We've been offered up some numbers. This is great. During a 1-year period, SMA from January of 2014 to January of this year, so that 12-month period, there were almost 760,000 logins.
And this year we're on pace to see close to 1 million. So patients have gotten very comfortable with technology. And again, you can access your records, your medications, a summary from your last visit. You can contact your provider. It's just incredibly convenient. And on top of that, if you want to be seen, you can go to Now Clinic. You can check in virtually online to our urgent care. Again, it's very patient-centric nowadays, as opposed to the provider being the center of attention. It's really about the patient.
I used to log on to websites to access my doctors and such. I used to log on to get information about specific medical conditions or questions. But there's a lot more than that out here on the website, obviously. So all I need to do is go to the website, log in, make sure I'm signed up, and get started. This is pretty cool. And it looks like even a year ago, and these numbers are expanding far beyond that, but it looks like about half of those visits online were people on their mobile devices.
Yes, I'll tell you, it's changed so quickly. When we first started telemedicine, about 2/3 of the visits were actually done from laptops and home computers. Fast forward 6 months, it's flipped around. So now the vast majority are done through mobile devices, smartphones.
Our smartphones are great. This is a really good answer. A win-win for everybody to help relieve some of the pressure with all of these extra people, the big numbers who now have access to medical care. I got no problem with that, but that means that we're filling up. We were already strained as far as what we had as resources for our quick cares, our emergency rooms and such. And if we can take advantage of it using our mobile device, our computer, and get it started that way, it cuts down on how many places we have to go to get our medical care, how long we have to wait, and it makes it easier for you from the doctor's standpoint as well.
There really is very little downside to telemedicine. I keep harping back, but we cannot continue on this trajectory as far as healthcare. The costs are just exorbitant. It's consuming our GMP. We want to direct patients to the right place, right level, and right time. So clearly, a lot of patients don't need to go to ERs. A lot of patients don't need urgent cares. This this is really just another avenue. It's more cost effective. And I can tell you, once again, every major insurer, health plan, large employer group, large medical group sees this as a potential to solve some of the problems in terms of healthcare costs.
This is going to help us do more preventative care, which benefits everyone in the long run. We're healthier overall. You take care of more people. The overall costs now will be diminished if we do this. I just don't see a downside here. It's worth checking into. Southwest Medical Associates, Dr. Eugene Somphone is with us. You've been with them 17 years?
Almost 18 years now. Like I said, I'm pretty stable, don't like change. It's a great organization to work for. I've seen tremendous growth. When I joined the company, I think we had 70 some odd providers. We're now approaching 320, 330 providers. So we have the largest multi-specialty group in town. It's a great organization to work for. Good medicine.
And a lot of the people who are listening today to Talking Solutions already are with SMA as far as their medical provider is concerned. So you affect and take care of a lot of people in this area. We're talking about the effects of technology on your medical care today on Talking Solutions. Technology has taken over. What about medical records? You used to go into the doctor's office, you had to fill out your medical history and blah, blah, and it was slow. I wondered if they could read my writing, quite honestly. It was just laborious. Now we're doing a lot of that online. So has this revolutionized the way that we do medicine?
It really has. When I first started in practice, we had paper charts. And when I joined Southwest Medical, at the time we had maybe a half dozen offices. Well, if a patient was seen at a different office, you would have to request those paper charts be transported to you. Now, we've had some kind of electronic medical records for close to 15 years now, and that really bridges that information gap. So if a patient was seen yesterday at a different office, I can pull up those charts. I can pull up their medical records, their prescriptions, what was done to them. I can even pull up their hospital records. There was a time where people would come in for certain conditions, and they say, well, I was hospitalized last month. I'm not quite sure what they did. Nowadays, you can pull up almost all that information through the electronic records. So I know that you were admitted last week to so-and-so hospital. You had so-and-so done. That allows me as a practitioner to be able to better make a decision just because I know your record, your medications, what was done to you previously. So it's helped tremendously. I can't imagine practicing without electronic records nowadays. I remember when we first instituted electronic records, the older doctors complained about it because it was new. Fast forward 15 years, if it goes down on that particular day, everyone is lost because now you're so accustomed to using that.
I've been at a visit where they were down, the systems were down, and it was more just, we were all kind of just chatting because you couldn't really do a lot of work because all of the information was on hold for just a little while until they got the systems back. Server went down or something like that. It's such a critical part of our medical care, but what a great part. Yep. And I do remember a door would slide open and you'd see the whole medical chart room, row after row of paper and pages and
We used to have a very large room called medical records. It's non-existent now because everything's stored electronically. The other thing that we've done over the last year is we started using voice recognition software. So now when you come in, I will dictate your note. It's available for everyone to see right away, real time. It's another thing that we're doing to hopefully progress medicine in the right direction.
And I know when I have medical tests, blood work or something, I make sure that all the doctors who are involved, I want them all to have that shared information so that hopefully we won't duplicate. We don't want to have to do those again on any side. So I want to make sure that they also have the information. But everybody seems to get all the info really fast now.
Yes, if it's on the same system, if you have a urine culture done, let's say 2 days ago, I have access to that. Now, the challenge sometimes is you have different electronic systems that don't talk to each other. We are trying to pool that data together. But right now, it's much more convenient if you're on the same system, the same closed medical group, then I have access to all of your records.
I'm liking this technology with medicine thing. This is nothing to be scared of.
No, not at all. We really embrace it, and it's really transformed how we practice medicine. Just so many different things, timely access to records, but also reduction of errors. In the old days, doctors write a prescription, handwritten, you can't read that. That's cut down on errors in that terms too. So I think overall the quality care is much better. We can track a lot of data much more easily, so we can look at our group's mammography rates, colonoscopy rates, those kind of things that in the past were much more difficult to really assess and to measure.
Thinking of all the positives here, if you have not tried things like Now Clinic or an e-visit for your own medical needs, this is something really to think about. Don't be afraid of it. The technology is benefiting all of us because it's relieving the pressure with the extra people in the medical system, be it at urgent care, emergency rooms, in any kind of medical office. It may save all of us on a medical visit, will save us time. Trouble of getting there will get us information with our providers more quickly. You as a doctor are able to service more clients and feel really efficient, I'm sure. There are so many good things about it. I think after we try it, this this way with technology, we'll look back on this and say, I can't believe we did it the old way.
Yes, and telemedicine is growing by leaps and bounds. Every 6 months, there's a new technology or new development. We're expanding the scope of practice. For us right here, this is direct-to-consumer where we're seeing primarily acute care needs. However, we're using this now to apply to specialty care. A lot of rural places where they don't have access to a neurologist, for instance, using it for stroke care. So they're really broadening the scope of practice for telemedicine. And I think we look at this 5 years from now, we won't even recognize the landscape because things are happening so fast.
Taking care of more people, it's less trouble on everybody. It's less expensive. We just hear all the time about how medical costs just keep rising. This is something that helps to keep it in check. Win-win all the way around. Today we've been talking about Now Clinic, e-visits, things that you can get involved with as far as the technical, the online portals with Southwest Medical Associates. Our guest today on Talking Solutions, Dr. Eugene Somphone. Thank you so much for joining us today. It's great information on Talking Solutions.
Thank you, Terry. It's a pleasure being here.
Have you noticed the fireworks stands are open till the 4th of July, coming up on the big holiday next Saturday? So we want you to keep in mind, be safe around the water, especially with kids. I'm going to talk with Joe Vasello with Paragon Pools about the Float Like a Duck program and water safety. He's in next on Talking Solutions.